Ancient Romans believed that either divine retribution, demonic entities, or an imbalance of the four senses of humor were to blame for mental sickness. Patients with conditions resembling anxiety disorders, mood disorders, dyslexia, schizophrenia, and speech abnormalities, among others, were observed by ancient Roman physicians. Similar to contemporary cognitive behavioral therapy, the Stoics used techniques to manage anxiety such as present, focused attention and scenario analysis. Alcohol misuse, hypersexuality, violence, and strong emotions were thought to be risk factors for mental illnesses like bipolar disorder. Cooling agents were applied to the patient's head as part of the treatment. Intellectually disabled people lacked legal safeguards and were stigmatized. They could still work as workers, though. Ancient Roman doctors and physicians may have been discussing mania instead of schizophrenia when they described people with potential schizophrenia. Ancient physicians recommended philosophizing, engaging in intellectual pursuits, vomiting, leeching, bloodletting, and venipuncture as treatments for them. Anxiety conditions. Roman physicians and philosophers recognized severe anxiety as a medical disease that could be diagnosed. The Stoics, Roman philosophers who advocated employing self-control to suppress unpleasant emotions, proposed strategies for dealing with worry. The Stoics used a technique called negative visualization, which involves imagining the worst-case scenario for an action or occurrence to mentally prepare oneself for its effects. This therapy is similar to cognitive behavioral therapy, a current treatment for anxiety problems. Additionally, they would practice their responses in their minds and look for ways to turn bad circumstances into positive ones. Roman Stoic philosopher Seneca believed that to overcome anxiety, one must concentrate on the present moment. Romans also used amulets to deal with anxiety and offer comfort. The goal of such practices was to train the practitioner to have little fear, which would eventually allow them to remain calm in challenging situations. Galen, an ancient Greek physician, treated a lot of people who had symptoms similar to those of major depressive disorder or generalized anxiety disorder, including sweating, heart palpitations, indigestion, dizziness, fever, weight loss, insomnia, changing skin tone, low heartbeat, and irregular heartbeat. Anxiety and despair are said to progress in severity in people with this condition. It was thought that such fear may bring about death. Galen claims that a feeling he refers to as LYP is the source of this sickness. Cicero, a Roman orator, distinguished between anxietas, solicitudo, and anger. The word LYP is sometimes rendered as distress or grief. He saw anxiety as being concerned about things that will happen later. Cicero defined anger as an emotional outburst. Mental illness. Roman medical writings from the period extensively discussed mood disorders. The term melancholia, today known as depression, was first used by Greek physicians to describe a condition that causes poor appetite, lethargy, sleeplessness, irritability, agitation, persistent anxiety, and hopelessness. In addition to illusions, misery, and cancer. According to Roman physicians like Galen, this condition also causes episodes of dread, indigestion, and doubt. According to Rufus of Ephesus, they also had hallucinations. He talks about melancholics who thought they were clay pots or that their skin had turned into parchment. Changes in behavior and appearance were also observed by melancholics, such as a darker skin tone, puffed up eyes, more hair, and disarray. Melancholy was split into three groups by Rufus. He distinguished three types, the first of which caused the entire body to become filled with melancholy blood, the second of which just impacted the brain, and the third of which predominantly afflicted the hypochondrium. A Roman encyclopedist named Celsus thought that bloodletting was the best method for treating this illness. If bloodletting was not an option, the patient should be made to vomit using a hellebore. Patients should also be allowed to exercise, engage in intellectual pursuits, and refrain from drinking alcohol. Neurological conditions. Intellectually disabled Romans had few rights. They could have been able to contribute to normal society by doing menial work. They were, however, also treated as the father's property or were maintained as slaves. People with intellectual disabilities were not allowed to marry, hold office, or have children because they were thought to be on the same level as children. These persons were viewed as a burden on Roman society. Many were murdered as children to prevent this, and their corpses were tossed into the Tiber to prevent them from becoming a burden on society. Roman law, however, absolved them of their crimes. The terms tarditas ingenii and lingua impromptus were used to describe speech abnormalities in ancient Rome. These conditions were viewed as indicators of stupidity. Such a disease, perhaps Tourette's syndrome or cerebral palsy, affected Emperor Claudius. His mother, as well as the rest of Roman society, perceived him as being cognitively undeveloped, less of a man, and naturally incomplete. A speech condition called stuttering is characterized by unintentional sound repetitions or pauses in speech. It was believed to be brought on by either an abnormally wet or dry tongue. Galen advised treating a stammer by wrapping the tongue in a towel dipped in lettuce juice. Tongue rubs and gargling are two other treatments for speech disorders. Brad, a young Roman boy, was mentioned as not being able to read, and Livy mentions Roman adults who were not literate to the same degree as young children. These individuals probably had dyslexia. Romans with dyslexia might rise to high positions in society. Bridua, for instance, became a consul. For those with intellectual disabilities, nutritious diets and exercise were common treatments. Even though he was intelligent, Suetonius characterized the Roman Emperor Augustus as having difficulties learning to read or write and having trouble recalling his speeches, which may have been a sign that Augustus had dyslexia. Suetonius, however, might have been attempting to draw attention to Augustus' flaws to make Hadrian appear to be the superior emperor. It's also possible that Augustus was illiterate or used strange spelling when writing. Schizophrenia. The term mania or phrenitis was used by ancient Roman physicians to designate a condition. This disorder was thought to be brought on by excessive levels of bile brought on by fever, which would heat the blood and bring on an illness. Ancient physicians observed that this condition mostly affected young and middle-aged males and that it only rarely affected children, women, or elderly people. On the nature of this disorder, contemporary scholars disagree. It might be schizophrenia, though. Others, however, contend that there are no references to schizophrenia in ancient writings and that the contemporary type of schizophrenia did not exist then. Roman physician Celsus described a mental disorder that resulted in delirium attacks and rambling speech. In addition, Celsus described a chronic illness that resulted in entertaining vain images and left the mind at the mercy of such imaginings, making a distinction between various forms of this illness. Different therapies were applied. For instance, doctors might criticize excessive laughter. Music was played with cymbals and was believed to lessen melancholy feelings. The patient's anxiety and dread were reduced by using philosophers. Patients should be treated through talk, according to doctors. The patient was expected to converse with the servants. They shouldn't, however, concur with all they say, as this could reinforce their misconceptions. Additionally, they weren't meant to argue with anything the individual stated because doing so might make them angry. To keep the patients interested, a range of intellectual activities were offered to them. Each patient would have received a unique set of these exercises. These patients were frequently segregated in a pitch-black space as a form of treatment. Celsus thought that different people responded differently to this kind of therapy. The darkness will startle some people while calming others. He suggested that patients who were strong should be placed in a bright room, while patients who were weak should be kept in a dark chamber. Celsus advocated for torture as well. Chains and whipping were used to confine aggressive patients. They utilized food deprivation, cold water immersion, harsh exercise, and light deprivation. Additionally, patients were expected to regularly move and only be left with someone they knew. To keep the patients from acting out of terror, they were made to pay attention and memorize this pain. Two doctors, Asclepiades of Bithynia and Cyranus of Ephesus, rejected this treatment as cruel. Instead, they thought that patients should follow a straightforward diet, engage in frequent exercise, and be confined in a reasonably lit room on the ground floor. They suggested that instead of using shackles to restrain them, soft materials, wool, or servants' hands should be employed. So this is the end of our video. Do you feel it helpful? Post your valuable response in our comments section below, and subscribe to our YouTube channel for more videos.